guys, this video is about massage for sports injuries, and I'm going to look at when massage may be useful, what it can do, and then instances where you should be really careful of massage and things that people claim massage can do that they don't really do for sports injuries and where they really not need it. So for those of you who don't know me, my name is Maryke. I'm one of the physiotherapists from sportsinjuryphysio.com, where you can get online physiotherapy assessment as well as treatment of your injuries. So have a look at the description of this video if you would like a link to our website. Good, so what can massage do for sports injuries? Let's have a look. First thing is, if I can get my slide up, it helps for pain. Massage is a brilliant tool to decrease pain, and the way that it does that is it desensitizes the pressure receptors in your tissue, and it also calms the fight or flight reaction down and the cortisol levels down. So that's how it decreases pain. So I have in the past used massage successfully for people who's had really painful injuries or conditions to just help to calm that pain down. But obviously it depends on how hard you massage for. Don't go and dig in as hard as you can when somebody is in a lot of pain. In my experience, it's got to be comfortably uncomfortable, and the patient has to be absolutely 100% happy with the pressure that you're applying. Otherwise, you can have the opposite effect. And I think the reason for that is part of the way that it calms the pain down is through decreasing your fight or flight reaction. So decreasing the cortisol levels and stuff. And if you're doing massage at a level that's really uncomfortable for the patient and they're not happy with it and they're feeling anxious about it, you're going to have the opposite effect. You're not going to calm down the fight or flight reaction. So it can work for pain, but you have to apply it at the right level. Then the second thing that massage can be useful for is for muscle tone. So unless you're dead, you have some muscle tone or tension in your muscles. So if you think of a slab of meat on a plate, all the nerves have been severed. That's how muscle looks that doesn't have any tone in it. Now, when muscles are irritated, either through stress or overuse or injury or just really exercise, the tone increases. So it becomes, I don't want to say in spasm, because spasm is something different. It just becomes a little bit more tense. And if it's too tense for too long, that can create pain and it can contribute to some injuries. So massage is a very useful way of decreasing that muscle tone. Again, in my experience, it's got to be comfortably uncomfortable for the patient when you do it. If it's too intense, it doesn't always have the same effect. You do not have to dig into a muscle to get it to relax. Firm but tolerable massage can get the same effect. I've even had lovely decreases in muscle tone with just very gentle massage. And that's because, again, it's not just a local reaction that we're getting through the massage, that the muscle fibers relaxes because of the mechanical pressure. But if you can calm the fight or flight system down and you can change the hormone levels, then you get a natural decrease in muscle tone as well. So think about that when you're applying your massage. Now, the third thing why massage may be useful for sports injuries is it can help decrease anxiety. There's strong evidence that it does work for that, and a lot of evidence in burns patients especially. Now I know that's not sports injuries, but if you can help with anxiety levels in burns patients who are in extreme pain, then I take that as very good proof that massage can help for anxiety. Do not underestimate how anxious a sports injury can make a person, especially if there's a lot riding on this injury that it may take them months to recover, if they have a race coming up that they really need to be ready for, if they just know other people who's had this injury and never made a recovery from it or bad recovery. There can be a lot of anxiety around an injury like this, and massage is a really good way to gently decrease that anxiety. Again, think about the level of massage you're using. If you're going to go and dig in because you believe you have to dig into it, and this patient is really anxious, you will likely just increase his anxiety. So read your patient and read the situation and choose the pressure of massage according to the person in front of you and the level of injury they have. Good, so Fourth thing is sensation. Brilliant tool to normalize sensation. So often you can get various types of injuries that can cause changes in sensation. So the most obvious one is if you have an injury that involves a nerve as well, you can get pins and needles, numbness, hypersensitivity, all of those types of things. And massage can actually normalize that pathway to the brain and how the nerve fire again. But once again, it's got to be at a comfortable level. And I often found with, especially injuries where there's nerves involved and it's super sensitive, it's actually better to get the patient to do it themselves. So mainly because of a trust issue as well. I think it decreases anxiety if you get the person to touch themselves instead of you touching them, because even if I think I'm touching you light, it may not be light enough. So, and the second reason for why it's good to get patients to do their own desensitization is it reconnects their brain to that injury. So we know from the research that often if somebody's had an injury, there's a bit of a disconnect between the brain and that injured body part, and the way that the injured body part is presented or represented in the brain changes. But through concentrating on that body part and kind of just focusing the mind on it and touching it in a way that feels safe for the patient and that isn't creating much pain, just a tiny bit of discomfort maybe even, actually helps to normalize that pathway. So massage is a massively important tool for that. But again, it doesn't have to be digging in. It can be as much as just touching the area like that. That counts as massage for certain situations like that. Another time when it helps with that is if somebody has had an injury and they've been so frightened of it, they've kind of just disconnected from it. So I have had patients in the past where they've done nothing. They've just left it, absolutely not moved it or anything. And you can actually get a total disproportionate response in that injury then, that you get that the sensation and everything changes in that. And then just touching it in a normal way and I guess decreasing the anxiety in a way, that settles or brings back the sensation to normal levels again for them. So definitely if you have a patient with changes in sensation, it's a useful tool to add in there. Okay, so let's see what is number 5. Scar tissue. Okay, massage with regards to scar tissue and breaking down scar tissue, as the words are that people often use, drives me a little bit nuts because it's used in the wrong context quite often. Bear with me. There's quite strong evidence that massage helps for scars in skin. So remember, you've got to distinguish between what tissue you're talking about in the body because it's all different cells. So if we think of skin, it's mainly collagen fibers and it's got very specific quality to it. So most of the, well, all the research I could find on the topic of scars and massage is done with regards to skin. So we're looking at burns patients, we're looking at, what do you call it, when people have surgery to make them look pretty, plastic surgery, scars in that, skin scars, scars after surgery type things, so knee replacements, hip replacements. And what the evidence is showing is that massage can be useful to help with that scar tissue, but you've got to be super, super careful with how you apply it. So the British Skin Foundation, their guidelines is that for immature scar, you have to use really gentle techniques. Now, how do you know if a scar is immature? Basically the scab's off, but you know how it can be a little bit raised and it's got a different color, so it's more of a red color, looks inflamed. And if you gently press on it and lets go, it goes from white to red again. So it's capillary refill. So that shows there's loads of little blood vessels growing in there. That's a new scar. And scars are seen as new scars, depending on the severity, between 3 to 9 months after the injury to that skin. So it takes a very long time for scar to mature. And if you're in that stage and you're doing strong massage techniques like cross frictions that people forever want to do on things like that, or deep massage over that immature scar, you can make the scar tissue worse because it's actually quite fragile and you can break it down and cause extra scar tissue in the end. Or worse, you can actually make it open depending on the person's genetics, because some people have very weak collagen in their scars and in their skin. Now for a mature scar, you can use harder or more forceful techniques. How do you know if a scar is mature? Usually the color of the scar is very similar to that of the skin. I have no idea if you can see. Can you see? Yeah, you can see that. That's a mature scar. Got it when I was in my teens and climbed over a fence. You can see it's a slight different color, but it's pretty much a similar color to the rest of my skin. That's a mature scar, and on that you can do stronger techniques because you can't really injure it anymore. You can just help to loosen it off. There's no sign of inflammation, so if you press, it doesn't look red, it doesn't look sensitive, and if you press on it, there's a capillary refill time, so you see that it's white first, but it doesn't rush to get red or anything quicker than the skin around it. That's a mature scar, and for that it may be okay to do stronger techniques on. So there is evidence that regular massage can help for burns patients and so on with their scar recovery, but that is all for skin. And also after like hip replacements, knee replacements, that type of thing. And if you look at the research around that, the way that they tell patients to massage immature scars is very gentle techniques of just rolling the skin, and it's for about 15 minutes a day, every now and again, but it's no strong techniques at all. It's just wiggling it. In my experience, actually that scar tissue loosens off through joint movement. So scars of the skin specifically can take up to 2 years to fully mature. And what you'll notice is that there comes a time that it just starts to loosen off from everything underneath it if you keep on moving that body part. So I've got plenty of scars from falling off things. Which side is my elbow scar? Can't see it now. I'm pretty sure it's, yes. I fell in a piece of glass. Ah, there we go, at university. So you can see it's right over my elbow, and that took ages to get better because it was a really, really deep wound. I didn't do anything for it. I didn't do any massage on it. I just used my arm normally. It's over my joint. Because it's forever moving, it loosened off. So for sports injuries and scars like those, I would personally say that movement of the whole limb is really important rather than just a few minutes of massage in that area. Now, we come on to the topic that drives me a little bit nuts. Scars and muscle. This whole video was actually inspired by 3 people in a very short period of time reporting in the sports injury physio group about how massage has made their injuries worse. And the person who specifically I made this video for, that I've got in mind, is somebody who had a hamstring strain, grade 2, 4 weeks later, strong massage, and she feels she's back to square one with regards to pain and dysfunction in that hamstring muscle. Muscle tissue is very different from skin tissue. Now, all the research has been done on scar tissue in skin, and even for that, they tell you to not do strong massage on fresh scars. Now, if you're doing strong massage on a newly torn muscle, and we're talking 4 weeks post-injury, you are really putting pressure on something that's still fragile in there. So think about the injury process here. You've got a muscle, it's torn, so the fibers have separated. You form a blood clot in there, which kind of bridges the area, and it acts as a scaffold for new cells to come and attach. But it's quite fragile. So if you're going to be too strong with massage in there, you're going to actually disrupt it, and you're going to cause worse scar tissue in the end. Now, there is no research about whether you need massage for scar tissue and muscles or not. And there's no research to show that it speeds up muscle recovery after an injury. This is not the same as saying it doesn't work either. There's just no research on that. From my personal experience as a clinician, I have seen plenty of people where they've gone in for massaging the injured area, or somebody has massaged too hard and they've made their injuries worse. I haven't seen any need in my patients for massage to help speed up the healing process of their muscle tears. Yes, I've used it if they've had a painful muscle, or I felt that the muscle was really uncomfortable for them, because it can take away trigger points and stuff that can make it more comfortable. But you do not need to go and mobilize that scar. It's strength training exercises that realigns muscle fibers and rebuilds muscle fibers stronger. That's what's important for scar tissue and muscles and getting a functional scar. You've got to load the muscle in the direction that it's going to carry load. So that's an important difference as well between skin and muscle. Muscles have to carry load, so the scar has to be loaded to become a functional scar. Skin does not carry load, it covers the body. So there's a very big difference there, okay? With muscle, if you just do massage, pain will go away, but you're never going to get a strong muscle, and it's not going to be a functional scar that forms, because it's not going to have the tensile strength to withstand the forces you want to be doing. So if you go into somebody for treatment for your muscle strain and they're only doing massage, you're wasting time and money, because they need to be giving you a strength training program at the same time. And from my own experience, you do not need massage to get better from muscle strains. You need a carefully graded rehab program and load management program to allow the muscle fibers to be offloaded just enough to recover, but also to slowly strengthen them up as they regain their strength. That's my bit about muscle tears. Now, the other one, and the reason I gave muscle tears an orange cross is because there isn't research to refute it and there isn't research to back it up. So I'm happy to change my view if a good research study comes out to show that it is valuable, but at this point, there's no research to back it up, and my clinical experience is that it's overrated for muscle tears. Tendinopathies, that's got a red cross, because a tendinopathy really does not need massage. So I despair when I see videos and articles and people talking about doing cross frictions on your Achilles tendon or other tendons to break down scar tissue. Tendinopathies does not involve scar tissue. And I will link to this from this video as well, to a video that explains how a tendinopathy works in detail, but I'll give you a recap of that quickly. So when you have a tendinopathy, you've got a failed healing response. So the tendon doesn't heal like normal and you go into a breakdown phase. Now, one of the reasons people say that you should use cross friction specifically and hard massage on the tendon is to stimulate inflammation to get the healing process to start. That sounds brilliant, except tendinopathies don't heal through an inflammatory response. They heal and strengthen the tendon in reaction to load and loaded exercise. The research is very clear on that. So no, you will get an inflammatory response in the tendon, but all it will do is cause pain. Trust me on this. Now, the second reason why they tell you to do cross-friction massage and stuff for tendinopathies is to break down the scar tissue. A tendinopathy doesn't have scar tissue and doesn't produce scar tissue. The lump you feel when you've got a tendinopathy is caused by the collagen fibers moving slightly away from each other and changing their shape and their organization. You get different types of cells in there. Now, the body needs to reorganize those collagen fibers and create new collagen fibers and get the right type of cells in there. And it needs load to stimulate it to do that. So strength training exercises, high loaded strength training exercises. Again, the research is very clear on that. So massage can't create new collagen fibers. It can't realign your collagen fibers, and it doesn't cause the right type of cells to move into that area. So for tendinopathies, please stay away from cross-friction massage. It will likely just flare you up. Yes, it can sometimes decrease your pain if it's not done too hard and you're at the right stage of healing. But a decrease in pain does not mean that it's healing. It just means that the pain decreases. And yeah, most of the time, the patients who's contacted me, it's actually just made them worse. Okay, so let me know if you've got any questions. Basically, the roundup of this is massage is useful, but it depends on the type of injury you've got, and it depends on the stage of healing you're in. And it's not a question, you do not need it to break down scar tissue in muscle tears, and you definitely don't need it for tendinopathies. Good. If you've got any questions, ask them in the comments, or you can message me direct. And if you want a link to our website, link is in the comments of this video. Take care.